Mr. Pritam Singh.
Mr. Speaker, sir, several members have filed questions relating to the situation at Westlite Jalan Tukang Dormitory, and with your permission, sir, may I ask to take questions 31 to 39 together, please?
Yes, please.
Let me first explain the healthcare and recovery protocol for the dormitory residents to set the context. In line with the shift to home recovery program in our community, the dormitories have phased in a dormitory recovery program since 2nd October in the transition towards living with COVID. 98% of dorm residents are fully vaccinated, and most are below the age of 60. A vast majority of recent infections are asymptomatic or mildly symptomatic. 45 larger dormitories now have dedicated blocks or rooms set aside within their compounds as dormitory recovery facilities, or DRFs. COVID-positive vaccinated workers who are asymptomatic or only mildly symptomatic can recuperate and be monitored in DRFs while being segregated from other workers. Additionally, we have set up 3 centralized recovery facilities, or CRFs, in the larger dormitories to cater for workers who do not have access to the 45 DRFs. The 45 DRFs and the 3 CRFs together have a total of 11,000 recovery beds. We will expand this recovery capacities if needed. We have also aligned testing protocols in the DRFs and CRFs with the rest of our community. Workers who test negative on their supervised antigen rapid tests, or ARTs, after 72 hours of isolation can be discharged. Workers are given thermometers and oximeters to monitor themselves 3 times a day and report these numbers. A recovery buddy is designated in each room to help with the dissemination of information and to monitor the health of fellow migrant workers. The dormitory operator also checks on them regularly. So far, over 17,000 workers have gone through the dorm recovery program and have safely recovered. The majority are discharged by day 7, and about half of them are discharged by day 4. The small minority who develop symptoms continue to have access to medical support through daily sick parades at our regional medical centers or telemedicine consultations, which are available 24/7. Mobile clinical teams may also be deployed to DRFs or CRFs with high report sick rate to augment access to primary care. In fact, fewer than 0.2% needed to be admitted to the hospital. The workers appreciate the convenience of dorm recovery since they can return quickly to their rooms and on discharge and resume work very rapidly. Let me now give an account of the events at Westlite Jalan Tukang Dormitory. This dormitory has about 3,000 residents. About half of them are employed by Sembcorp Marine, and almost all of them are newly arrived workers from China in the last 3 to 4 months. These workers were offered vaccination under our national vaccination program, with a small number taking it up. The employer has since clarified that these workers had been vaccinated in their home country before arriving in Singapore. The vaccination status of these workers needed to be verified through a serology test and WHO EUL vaccination documentation before we can register them as being vaccinated in Singapore. MOM has been working with the employer to expedite the verification, and progress has been made. To date, about 60% of the Sembcorp Marine workers have been verified to have received WHO EUL approved vaccines. While a number had not been vaccinated with WHO EUL vaccines, and we encourage them to be vaccinated in Singapore for their own protection. Following the implementation of the dorm recovery program on 2nd of October, the dormitory operator began adjusting to these new protocols. On 10th of October, there were 174 newly detected polymerase chain reaction or PCR and antigen rapid test or ART positive cases. However, the dormitory operator had difficulty processing the sudden surge of workers that needed to be conveyed. The next day, on 11th of October, some key members of the dormitory staff did not come to work as they themselves had tested positive. The Assurance, Care and Engagement Group, or ACE, officers on the ground stepped in on that day to assist the operator. In response to the sharp increase in the number of COVID-19 cases on 10th of October, Sembcorp Marine and ACE carried out a mass testing exercise on 12th of October at the worksite and the dormitory, which yielded another 278 COVID-19 positive cases that needed to be conveyed from the dormitory to a CRF if they were vaccinated, or to another appropriate isolation facility if they were unvaccinated. This happened while the team was trying to process the previous surge, and the dormitory operator struggled to process the high volume. While ACE officers tried to assist the operator between 11th and 12th of October, it too did not put in enough resources during this time to triage, to process, and convey the COVID-19 positive workers before the second surge on the 13th of October. So following the incident on the 13th of October, ACE took swift actions since that afternoon to stabilize the situation. First, we doubled the number of officers to manage the conveyance of all infected workers from the dormitory, such that by the evening of 13th of October, about 70% of the workers needing conveyance had been sent to the appropriate recovery or isolation facilities. By the next day of the 14th of October, the backlog was cleared. In addition, ACE officers, together with the employer and dormitory operators, engaged the workers and assured them that their feedback would be looked into, and there would be timely conveyance of infected individuals. The workers calmed down and returned to their rooms. ACE also deployed a mobile clinical team to the dormitory to augment the existing medical services that were already available to the residents at Westlite Jalan Tukang Dormitory through the regional medical centers and telemedicine. All those who wanted to seek medical attention were seen by the medical team on site on the same day. This helped to reduce the waiting time and allay much of the fears and anxieties that the workers experienced. The situation has been calm in the dormitory since October 13. Over the following days and weeks, ACE officers, together with the employer and the dormitory operator, continue to be at the dormitory every day to engage the workers. In fact, over the last 2 weeks, ACE has more videos and infographics to better explain Singapore's strategy in dealing with COVID-19 and the recovery process in our dormitories, in view that the newly arrived workers at the dormitory were used to a different COVID-19 management strategy in their home country. In particular, there are now videos of migrant workers sharing their recovery journey and assuring their fellow migrant workers, as well as videos of doctors answering common questions from migrant workers in their own native languages. So I urge employers and dormitory operators to do more to help our workers adjust to the new normal, communicate changes that will affect workers' well-being, and actively address potential knowledge gaps of their workers and residents. We also call on workers who are not vaccinated or not verified if they are vaccinated overseas to complete their vaccination or verification as soon as possible, as this will protect them from serious illnesses. MOM and sector agencies will monitor this progress. We also saw many of our partners coming in to support the workers after the incident on the 13th of October. We are very grateful and encouraged by the outpouring of support by the Chinese business community, the Chinese embassy, NGOs like HealthServe, Migrant Workers Center, and the wider community. This is testimony to the civic-mindedness and the big-heartedness of our community here in Singapore. Thank you so much for your help. This is similar to how, at the height of pandemic last year, MOM worked with the High Commission of India and the Bangladeshi High Commission, as well as various NGOs, to support our migrant workers, including celebrating festive occasions with them. We thank all parties for their contributions and donations, and we will continue to work together to care for our migrant workers. Workers also raise concerns about the quality and hygiene standards of food provided by Sembcorp Marine. We take this very seriously and have asked the employer to address the complaints. The employer has reported that they have made improvements to the food, and the feedback from the worker has been positive. The ministry will not hesitate to take actions against any errant employer who fail to ensure workers' access to safe food. The Singapore Food Agency is also investigating the food safety practices of this particular caterer. So in summary, there were shortcomings by all parties. On the employer's part, workers were upset and had raised issues about food quality and hygiene. On the dormitory operator's part, they struggled to cope with the surge in numbers. On ACE's part, we stepped in, but did not put in sufficient resources in time to resolve the problem. Following the incident, all parties have diligently addressed the issues, restored calm to the dormitory and to the workers. We have also conducted a thorough review and tightened up the processes, especially for escalating and calling in more resources to deal with the surge in cases that needs to be conveyed. ACE has also tightened up coordination and communication with dormitory operators and employers when handling mass testing exercises and a surge in cases. Investigations into failures to fulfill regulatory obligations, for example, in food safety and hygiene issues, are ongoing. All parties across our more than 1,300 dormitories, whether it's dormitory operators, employers, and ACE officers on the ground, play important roles to support the recovery of our migrant workers. More than 17,000 migrant workers have recovered under the Dormitory Recovery Program with the support and the hard work of all these partners. We will learn from this episode, continue to strengthen the partnership with all stakeholders and community partners to ensure the well-being of our migrant workers as we transit into endemicity. Thank you, sir.
Mr. Pritam Singh.
Thank you, Mr. Speaker. I'd like to thank the SMS for his comprehensive reply to my PQ. I have a question pertaining to the MOM's ACE group, which was a new division set up last year, taking over from the Interagency Task Force. And it pertains to the deployment of forward assurance and support teams. It would appear from the Senior Minister of State's chronology that between the 10th and 12th of October, there were gaps. Can I seek confirmation from the SMS as to the manpower situation within ACE itself, whether there are enough individuals and teams to cover not just this particular dormitory, but the vast number of dormitories in Singapore? My second question pertains to the first part of what Senior Minister of State shared with regard to the Dormitory Recovery Program. And I would like to seek an update from the SMS as to what is the situation with the various pilots, I believe, that were launched to allow workers to reintegrate into the public space, and whether this can actually be moved along in a more deliberate manner, because I understand from individuals in the HealthServe side of the house that mental health concerns are becoming more noteworthy. Thank you.
Sir, the member asked two questions. The first one is on whether we have enough ACE officers to cover the number of dormitories we have. The reality is that we have 1,300 dormitories, big and small. There will never be enough to go around on a regular basis to plant people in all 1,300 dormitories. But how we go about doing this is to leverage on the partnership we have with our stakeholders, the dormitory operators, the employers, And of course, we have volunteers within the migrant worker community, the Friends of ACE, where they are also ambassadors who are migrant workers themselves who have been here for some time. They are trained and equipped with some of the basic knowledge to share information with their fellow workers, to help spread the message, and also to help to collate feedback and channel upwards to all of us. So in a way, it is about leveraging on the multiply effect of everyone to pitch their hands in and work together. As a member will appreciate, to have operations within 1,300 dorms, big and small, with different phases, perhaps, of infection, of liberalization, of going to the dorms, of going to work. The work to necessarily coordinate across all the different stakeholders, as well as to ensure that when a case is detected, documentation of the COVID positive result, churning up a nominal roll, a name list, communicating the need for conveyance, and then for the team to arrange for the necessary transportation, having also the other receiving party at the other end at the dorm recovery facilities or the CRFs, the community or the DRFs, for example, the centralized recovery facilities. It is a necessary complex process that involves quite a bit of communication and coordination. So we do make sure that our ACE officers are prioritized in terms of going to dorms that needs help, right, rather than have them spread thin over all many places. So in a way, it is about risk stratification, it's about prioritization. And I think at this moment, we are working with what we have. When there's a need to, if there's a real major surge in demand that we need to augment our numbers, we will look at increasing the number of ACE officers that we need to deploy to. The second question pertains to how much more we can do in liberalizing community visits for our dorm workers. I must say that our dorm workers have been very, very patient, and they have actually gone through a lot in the last 1.5 years or so. In the past month or so, we have started a community pilot visits for workers who go into the community. We started with about 500, and then with the success of that pilot, you will see in today's newspaper that an announcement has been made over the weekend. Minister Tan See Leng himself visited one of the Hindu temples with many of our migrant workers. And we are going to increase that number to 3,000 workers a week, especially with this festivity of Deepavali coming along. Many of them will be looking forward to community visits as well. Progressively, as we stabilize the dorm recovery process, as the community also gets adjusted to more of the home recovery process, as we move more and more into the endemic state, I believe that we can gradually reopen a lot more numbers to allow our workers to access more community facilities. We are also liberalizing the number of times our vaccinated workers in the dorms can go to the recreational centers as well. So there are less restrictions going to recreational centers. That again offers another outlet for them to access services, to also have the necessary interactions that they need at the recreation center on top of the community visits that we are liberalizing. Thank you, sir.
Desmond Chu.
Thanks to SMS, I have two supplementary questions. The first one is, the NWC has been working with MOM to help in management of dorms. So for this particular incident, why wasn't the other agencies or NGOs brought on board to support ACE for the few days? Is it linked to certain critical priorities that MOM might have? The second supplementary question is on the vaccination of these workers. I know there's a requirement to bring in only vaccinated workers. So in this instance, why were certain number of workers not vaccinated? And how can we prevent and enhance the arrival of such vaccinated workers for future batches? Thank you.
Mr. Speaker, I thank Mr. Desmond Chu for these two questions. On the first question relating to why the NGOs were not brought in earlier, let me explain that when the surge in cases occurred, the topmost priority in the mind of our ACE officers who went in, I think it was on the 9th and 10th, to augment the dorm operators. The topmost priority was really to do the processing and to do the triaging of those who may have a need for medical care. And in fact, on the 9th of October, a mobile clinical team was actually deployed on site to help cope with the load of increased number of residents who may need medical attention or seek consultation. So I think the priority there is very clear. It is about making sure that our team on the ground focuses on what is the most urgent need, and that is to really take care of the medical condition. Make sure they are well, make sure they are safe medically first. And the next priority then was also to ensure that we can stitch the logistics together and make sure there's enough conveyancing capacity to bring these workers to the necessary isolation facilities. And that situation, I think with COVID cases that are going up in a dorm, it would not be appropriate to actually allow NGOs to be exposed to the risk of infection in a dorm like this. And because the work then was about medical care, was about conveyancing, it's not necessarily something that the NGOs have the capability to provide as well. Right? So I think it's therefore the reason why in the first few days, our ACE officers and were working with what resources we have with the dorm operators to make sure that these important needs are met. When the situation has calmed down after the 13th of October, by the night I said 70% have been conveyed. By the next morning, about all the rest of the backlog has been cleared on the 14th. And this is where the rest of the NGOs, and in fact the embassy came in after that, only on the 14th, for example, to actually also provide some of these supplies like masks, hand sanitizers. These were useful as a psychological boost for our workers, but by themselves, they will not be able to address the medical needs. And so I think it's quite clear from the sequence of events, the team was on the ground early on to try and manage the medical situation. The second question of vaccination, why there are so many so-called unvaccinated workers coming to in Singapore. The truth is, you must remember this happened about, when the workers came in, it was about 3-4 months ago. I think the earlier batches came in about mid-July, and then another bulk of them came in around August. At that time, we were still in the zero COVID situation. We were trying to contain the numbers. And therefore, while we have NTL, some of the high-risk countries, for low-risk countries, we actually do not have NTL for them. And China is one of those countries where they have very, very low numbers, and we did not NTL China workers from coming in at that time. At that time also, our dorms were not into the endemic posture, and so even if the workers turned out not to be vaccinated, there was a way to keep them safe. But in this process, by October, we were transiting to more of an endemic posture, and those workers who came in earlier on, when we were still pursuing a zero COVID type of strategy, would therefore be caught in that transition if their vaccination status was not up to the mark in terms of personal protection. And that's why we are encouraging both the workers and employers to get this thing sorted as soon as possible, and for those who yet to be vaccinated, to get them vaccinated. You will read also from, I think, from our previous announcement that from today onwards, which is actually today, 1st November, only work pass holders who are fully vaccinated will be allowed to enter Singapore for work. So this will be an adjustment that we are making from today onwards in line with our endemic posture to make sure that whether it's anybody who's applying for work pass, we make sure that they are vaccinated before we allow them to come in. So this is a gap that will gradually narrow over time. We're now digesting the group of people who came in just before that, who may then have a certain vaccination gap that we need to fill. Thank you, sir.
Mr. Leon Pereira.
Thank you, Mr. Speaker, sir. Thank the SMS for his answers. I have two supplementary questions just on food quality. And I know SFA is investigating the food quality claims around this particular incident, but in general, on food quality for migrant workers, there have been concerns about this going back years. There was a survey, for example, 2015, that talked about how the majority of workers felt the food was unsatisfactory, unclean, and so on. There have been improvements since then. Two questions. Firstly, NEA has regulations that govern the quality of catered food supplied locally to Singaporeans. And I know there were revisions to these rules in March 2020 to require food establishments providing catering services to have CCTVs, to keep retention samples of the food. So do those NEA guidelines for catered food supplied to Singaporeans, do they also apply to catered food supplied to migrant workers? Is that applicable? Is that enforced? And secondly, what is being done in general to look at the standards of food supplied to migrant workers beyond just the Jalan Tukang incident, in particular around what you hear, frequent reports about the food being prepared the day before, and there can be a long period of time that elapses between when the food is prepared and is consumed by the migrant workers. Thank you.
So I don't know how the member can get feedback from these workers for years and years when they all just arrived in July this year. So I'm not sure whether such a claim is absolutely correct, that this complaint has been going on for years and years. These workers are here less than 4 months. NEA regulation that applies to dorm caterer, yes, I think it's a standard that will apply across to all catering, whether it's for the dorms or for other public consumption. The standards for feedback for standards on food hygiene. There are various avenues in which the workers can feedback. First, of course, we have now the foreign FWMOM app, which is an app that all foreign workers can download onto their smartphone. Through this app, they can actually feedback directly to MOM, to ACE, for example, on any issues relating to their dorm conditions, including food. So that's something that workers have direct access to our agencies. The second thing is that there are volunteer groups, NGOs, who are in regular contact with our workers, what we call Friends of ACE. When they're organizing activities, where they interact with workers, this is, again, another channel of feedback. And I must say our NGOs are very, very much pro-workers in that sense, and they will not hesitate to tell us when there are any feedback that they receive regarding substandard, either accommodation or food. The third, of course, is that the Migrant Workers Center, MWC, has established a network of what we call migrant worker ambassadors that are scattered throughout all the different dormitories. And these are actually foreign workers themselves staying in the dormitories who have been here in Singapore for many years, some of them even for a decade. And they are quite familiar with the settings, they are quite familiar with the standards that is to be expected on a day-to-day basis. And they again form another channel of feedback to the relevant authorities and to the NGOs as well, if standards were to drop. The final one is, of course, Migrant Workers Center runs a hotline where all other foreign workers, if they do face challenges they cannot get through to their employers or to anyone else, can call this hotline, where they can actually also directly feedback to Migrant Workers Center as well as the ambassadors who speak their native languages to collate all those feedback. So I think there's no shortage of feedback, and clearly some of these things, if there were language barriers, we need to look into. In this case, I think that because they were very much newly arrived workers, they may not be exactly familiar with many of these resources open to them, and this is where we need to communicate to them that there are avenues they can seek redress. We will also take this chance to impress upon all employers that it is their responsibility and their obligation to make sure that they provide food of decent quality, of hygiene standards that their workers can consume. And if there are investigations that show that employers have actually violated any of these obligations, we will take them to task.